non-communicable and infectious diseases. Under 5 years of age is critical window of period for their optimal physical and cognitive development. If this window closes, it will cause irreversible damage to children, making harder for families to rise out of poverty. Undernutrition among children in India is a major public health problem. India has the highest burden of undernourished children with almost 40% undernourished children and 34.7 stunted children. We all have understood that malnutrition is entirely preventable and community management of malnutrition is key to it. Addressing community management of acute malnutrition requires complementary, multi-sectoral, and multi-stakeholders engagement and approaches that respond both to long-term development challenges and to immediate needs linked to the survival and well-being of our children. In recent past, government has taken various innovative steps to combat undernutrition among our children. Our policymakers, departments, frontline workers, all are working extremely hard to save our children from the burden of undernutrition. It's our shared responsibility to extend our support to them in fighting against malnutrition. This year, we are celebrating 4th POSHAN Maah, and Save the Children has attempted to bring all the key leaders and actors at one platform to discuss and deliberate on how effectively we can strategize to prevent and manage our children from acute malnutrition at community level. We have domain experts and policy makers with us today to enlighten us with their insights. I again welcome you all on behalf of Save the Children. Before inviting our eminent speakers, I would like to request all our participants to post their questions in question and answer section, and we will try to address these questions in post discussion during the question and answer session. Moving forward, I would like to take this opportunity to invite CEO Save the Children, Mr. Sudarshan Suchi, for his welcome address and opening remarks.
Thank you, Sonal. Good afternoon, everybody, and thank you, Rakesh ji, for sparing your time and joining with us. I will look forward to hearing from you, your perspective, and through you, the larger Niti Ayog's context going further. And while you are there, I would also like to use this platform and opportunity to provide how the world looks like from our side, hamare kya soch hai, and why this topic and why today. So I don't think there's much needs to be said around the status of nutrition, malnutrition, and the prevalent depth and breadth of the problem or challenge. But let me first narrate something totally personal and something which I experienced and lived through and was wondering what does it have to do with today's topic. So aside of having spent a lifetime working in the rural India and the marginal communities, one prominent example with one village where I personally worked for long years comes to mind. So I, with all my data, secondary information, understood that this Gond tribal village in central India, Madhya Pradesh, Sivni district, severely impacted by malnutrition and lack of basic health facilities nearby and inadequate even food. So in the engagement journey there and along again with National Institute of Nutrition at Hyderabad and elsewhere, I figured out all the right answers. So the first right answer was create a kitchen garden and have a method of sufficient vegetables. The second was revive the traditional millets, kodo, kutki, etc. to make sure that the not just the iron and all, but micronutrients also come from. And then try and find resources to get this implemented. Then in the context of SAM and MAM, connect with the nearest center, everything. 2 years, no progress. In fact, if anything, regress and nothing changed. Kyun hua ye? It was because somebody whose reality, I mean, my reality was not all this, and those whose reality counted, I had not consulted them. उनसे पूछा ही नहीं था कि how does the world look like from their side, what are their solutions, why, if they could also know. Kodo Kutki was not new to them, they grew there. I mean, they are from that area. It was new to me somewhere in Bombay. Similarly, vegetable garden. So vegetable garden, kitchen garden project we created, people wouldn't harvest those vegetables to eat regularly, they rotted. 2 3 lessons for me which were very important was, one was I missed the part that aspirationally wanting white rice and white atta was a statement of a social ladder to climb, and that was far more important than perceived source of nutrition. And the vegetable garden again was a prescription without consultation as to what vegetable to grow, how, when, and what condiments to use to cook and all. So solutions kind of being thrust upon people was one important lesson I learned, that even if they are right and good solution, they don't work. Right way of doing things is far more important than just doing right things. And I think what we are doing today is to bring that discourse to a larger platform, that the primary stakeholders need always to be in the forefront. It's their reality which counts, and they need to internalize, drive home, or rather any initiative or any problem solving or any engagement in development metrics will succeed only as far as jitni dur tak the primary stakeholder holds, immerses and understands it. Until things happen fixing from a distant, remote or top context without transference of that concern to people, I think it starts and stops to the extent that it becomes a कि कहीं से, so people ask कि इसमें मिलेगा क्या, more than let's say a nutrition problem being solved. Yeah. And similarly with Sam ma'am context, one noticed that while one was in the health center, things worked. The moment people went back to their home and restored their lifestyles, a marginal family from a marginal context, status quo ante was quickly receded to. So I think that there is a time and there is a space, and I think the orientation, and I think to a great extent this government has been doing that, I must acknowledge. In fact, the word aspirational district, Rakeshji, I remember when I first met you long back, you mentioned that even this came as a positive stroke for an engagement for people, not as a deterrent or a stake. And I think that symbolizes, so for us, even this context, okay, if we are living in a certain problem, can we engage in participating in how we can resolve our problem? And I think around that narrative, rest of us have an opportunity to take our positions as to, if there is a community who are a primary stakeholder, then around them, how do we realign ourselves? How do we become a part of their lived experience journey? And now this particular context of last 2 years further actually provides. So मुझे ये लगता है कि for all the development practitioners at various level, any complexity in a situation is an invitation. It's an invitation to be a part and immerse ki what more innovation can come जिससे is complex. I mean, like last 2 years has been the remoteness, inaccessibility, distance, and the social exclusion. So around this, the same stakeholders' concern has to be brought. What new ways in which to listen to them? What are the supports which can be provided even in the current context? So all this has provided us an opportunity to reorient ourselves, to figure out as to how, if the schools are closed, if the AWCs are closed, if the basic assumptions of ours are all challenged, उस दरमियान में how do we come up with solutions which continue to respect the spirit of community driven, community owned. मेरा ये पर्सनल विश्वास है राकेश जी, एंड टू ऑल ऑफ यू आई वुड से कि जो हमारा लास्टिंग ट्रांसफॉर्मेटिव सोशल चेंज हम खोज रहे हैं, वो लोगों के अपने अंदर के ओनरशिप से ही आएगा. वो इट विल नॉट कम फ्रॉम एनी एक्सटर्नल इंटरवेंशन, whatever it is. The external interventions have to tune with the fire in the belly and the desire within the community or in the people impacted to want to take charge. Till they remain prisoners in their mind of their circumstances, all the rest of us will not be able to bring about any change, certainly not lasting change. So I think Poshan Ma in that sense, I feel, is a symbol of going back to that context, revisiting how much we can learn and how much we can unlearn in terms of right way of doing things को हम follow करें, rather than making sure कि right things हैं, right prescriptions हैं, but for the speed or maybe for the temptation of quick success, we trade off on the right way of doing things. So I think Poshan Ma is an invitation to all of us. And मेरे को ये लगता है कि this marriage between civil society organizations and Niti Aayog is essentially, the power of it is essentially around this. Niti Aayog can think big, civil services organizations can think small. I think neither small one-off engagement will serve purpose, nor thinking big without having ground zero ka visibility will. But when we blend dono cheezein together, I think that lasting change for the largest number will surely come. Many smalls multiplied into a method under the aegis of Niti Aayog. And I think this is what we are really all looking for. On behalf of Save the Children, I would like to make a commitment that we are all the way into this, into learning, unlearning, and rediscovering कि whatever it takes, कि वो लास्ट माइल से आवाज आप तक पहुंचे, राकेश जी, एंड आपके साथ जो भी मेथड्स हम लाएंगे उसको लास्ट माइल पे एज अ प्रूफ ऑफ कॉन्सेप्ट वी विल एस्टेब्लिश, सो दैट लोकल गवर्नमेंट्स को वो स्केल करने में आसानी हो. And knowledge and skills and competencies is something we can certainly help multiply. Thank you everybody, and I think this platform is wonderful and has immense promise, as much promise as we want to take with it. And कान अपने जमीन पर हम लगाएं और समझें और सुने. So thank you again, Rakesh ji and everybody. Thanks.
Thank you so much, Sudarshan, for setting up the context so beautifully and stressing upon the community-based solutions, and also sharing your personal experience on nutrition. So going forward, now I would like to request and invite Dr. Namrata Jaitley, who is Director Policy and Program Impact in Save the Children, for welcoming address to our keynote speaker and for further modification. Dr. Namrata Jaitley, thank you so much.
Thank you so much, Sonal, and I just want to thank Sudarshan also for setting the ground for a very rich discourse. So I again take the opportunity of welcoming Shri Rakesh Ranjan, who's the Mission Director, Aspirational District Program. And as Sudarshan, very rightly said, I think Niti Aayog has, we along with Niti Aayog, we can actually ensure that community management of acute malnutrition becomes a reality. And what we had requested Rakesh, who is the Mission Director, Aspiration District Program, to actually highlight in his keynote address the government initiatives for improved equitable access to essential nutritional services to achieve the nutritional goal. So before I invite Rakesh ji to share his insights, I'll just briefly introduce Rakesh ji. So Rakesh ji is, like I mentioned, he's the Mission Director for Aspirational District Program. And I just want to highlight the importance of the Aspirational District Program, which is being anchored in Niti Aayog at the central level, with active participation of state government and district administration. So, as Sudarshan mentioned, Aspirational District Program actually aims to rapidly transform the identified 112 of India's most developmentally challenged districts across sectors like health and nutrition, education, water resources, infrastructure, skill development, and financial inclusion. So Rakesh ji, as a mission director, we really look forward to getting your insights on how not only through the aspirational district program, but also through the POSHAN 2.0 and other government initiatives, we will be able to ensure community management of this severe problem of undernutrition. And before I further move on, I just want to also highlight that, from 2009 to 2016, Rakesh was serving in the Planning Commission, and as Joint Secretary, he was part of the core team which facilitated the transition of Planning Commission to Niti Aayog. And he's worked on multiple key food portfolios in infrastructure and urban development sector towards shaping an urban strategy and provision of infrastructure in India. So over to you, Rakesh ji. There's a tall order for which we wanted your inputs, but we would be very happy to hear from you in terms of not only how government is prioritizing and strategizing on this whole addressal of the nutrition goals, but also more focus on the aspirational district program, highlighting some key challenges which government is facing. And as Sudarshan mentioned, where is it that civil society organizations can also partner with the government to ensure that we meet the nutrition goals of the most malnourished and undernourished children of our country. So over to you, sir.
Well, a very good evening to all of you. Am I audible?
Yes, sir. Yes, sir. Yes, sir, you are.
So, good evening, Namrata ji. Good evening, Sudarshan sir. Good evening, Sonal. Good evening to all the distinguished people who are part of this very, very good program that we tell you, useful one. Anybody who talks about nutrition is definitely doing a very good and very useful thing. First, let me register my complaint against Mr. Sudarshan Suchi. For one simple reason, that whatever in my limited mind I thought of speaking, he spoke all and much better than me. So where is the keynote address after that? It will be kind of repetition of some of the things that he has said. Now, having said this, let me try to tell you that where we are expecting your role, because for us, the most important thing is that in what kind of collaboration that we come and that we can set. An aspirational district program is one of the important platforms to do precisely that kind of thing. I'm sure good part of the government want to do that collaboration. That whatever we have put or whatever the government has put on ground is worked. Because the first most important challenge that we have is not necessarily the nutrition, because that is an outcome challenge. The biggest challenge that I find is that the government has put resources, the government has put arrangement, the government has put very well thought of systems in place, and they are not utilized to the way that they should be utilized. Just think of it. I mean, just you have for nutrition, I mean, everybody knows, and I agree with Mr. Suchi that there is no point keep on harping on this nutrition, very important. Everybody knows that 1,000 days of the child, the first 1,000 days is something which is very important. And there are, I mean, it is very well recognized problem all over the world. It's also, I mean, its tools to handle is also well recognized all over the world, that how to handle this particular problem. And compared to India's of 1950s, I mean, one of the things that India seems to have solved is the problem of lack of food grain or something to do with the starvation. What India has solved is the problem of starvation, but what we need to do and what we need to change is to change the nature of the food that people have, or what they treat their women and the way they treat their children in the home. I mean, that is what we need to change. So just, I mean, closer, reflect for a moment. I'm telling all the audience that just reflect for the moment and think about the thing that the government or the civil society or we as a society have already done. And we have nutrition is one of the forefront within Government of India. The Ministry of Women and Child Development is very important. If every state government, the department which holds the children as well as the women, the issues are very important. So in the first place, when somebody says that, is it receiving the policy attention? The answer is yes, yes, and yes. Not once, but on many occasions, very senior people in government, both at the central and state level, speak about nutrition, speak about our dismal performance vis-a-vis the GDP, because, I mean, given this level of GDP, we have a long way to go. But at the same time, even at this level, the nutritional status of India is not consistent with the present level of development in this country. Actually, the countries with much lesser per capita GDP had better nutritional status than what we have at present. And that is why what I say is that If it is the question of that whether it is not receiving the policy attention, the answer is no, it is receiving the policy attention. So then where is the problem? So we have not put the structure in place. Now let me see. Integrated Child Development ICDS program of Government of India with the Anganwadi Center is very much there. It is functioning under the Aspirational District program. We keep on getting sometime a very depressing request that some of these Anganwadi Center, they are not running in the proper building. They should be run on the proper building. And I'm sure that in few years' time, at least in a 1 or 2 year time, almost all building will improve. In many ways, the interior of the ICDS have improved. In many ways, the equipment that people are holding within the ICDS has improved. And so there exists an ICDS, but the challenge again is that not all children go to ICDS. Now that's a very big challenge. And there I put the request to all the civil societies that, see, to assume that the government is capable of reaching the last mile is something which is not so, it's not so realistic. Especially, I just think of a block development officer, or I think of an officer at the block level, which is looking after the children's development, looking after our foot soldiers, which is Asha worker and Anganwadi worker. They are going to every household, try bring everybody in there to come, every child to come to and take advantage of what is there in ICDS. Ideally it should have happened, but it doesn't happen that way. And sometimes in some places, the figure are more than 30 to 40% of the children are not coming to the ICDS in the first place. So the starting point of a particular chain of the arrangement that has been put forth doesn't work. Now, the second issue that you say that, okay, the government even thought that fine, if you're not coming to ICDS, even at the stage of pregnancy, we will have supplementary nutrition program, both for the mother as well as for child. And within the aspirational district program, it is a very, very important indicator that we kind of monitor that whether the supplementary ration has been kind of provided at the home. Now, there is a separate issue that within the home, the dynamics of the home is that whether this ration or this is something which is, whatever is the food that is being given is available to the children or to the pregnant mother or to the mother, lactating mother, whether this is available or not. Now, that's a separate issue. But just think of this. There is a Matrit Vandana Yojana that you take care of the mother as well as child at the pregnancy stage. There is a supplementary nutrition program. There is a scheme for adolescent girl and national creche system scheme. You think of in the whole chain of the nutrition, you think of a particular thing. Those people who are there, who runs the ministry here and who run the ministry at the state government, they have thought of it, and they have tried to put the system in place. Now, with all this thing in place, if our result is what the NHFS survey of 344 districts showed us, the first thing it's a quite disquieting one, because in the first place, the NHFS 3 to 4 transition was fairly painful, where we realized that the improvement is very, very slow. Now, NHFS 3 to 4 is like this. NHFS 4 to 5 has not seen a major acceleration, and that is what makes us the challenge which is there. So the question is that what is it that when the government has put in place a good part of it, and still it is that we are not there where we are. The ministry has put a wonderful system of capturing of the data from ICDS itself. They call it CAS system or something. And I'm told that for last 2 to 3 months, it's not working. As I think there is an attempt to kind of put it back on the system. So what exactly is missing? Now, somebody says that what is missing is a community approach. Now, please remember, I'll take you back 1950s. India's buzzword was one thing was Malnutrition model on one side and community development was another. It was the first Prime Minister of India was fairly convinced, and I think there was a very large part of the government's narrative at that time was that the communities should come together. In fact, there was a thought that India was a great country for the community to come together. Sociologically, we are built like that. And that's where the community can come together and solve a lot of problems. So despite the attempt for kind of putting the community in the whole process, and despite the attempt of putting the system in place, which I would say the physical system, so the heart was there, the soul was there. Why is it that we are not where we were? And I think the reason, which I would say, I mean, my humble opinion is that the community and the government interaction is poor. That is my humble opinion. Because what I feel is that, say, in a system where let's take example of Jharkhand. All of a sudden, we see the supplementary ration being distributed 90% in 1 month and 15% in another. Why do we see this? Because somebody has not done the work on streamlining the supply side of it. Now, this is not a mistake in a sense that you don't have money. No, you have the money. But in 1 year or two, in a 1 month or 2 months, the supply side is that for 2 months, the supply has not come. And after 3 months, the supply for the last 3 months has come. Now, when you have this particular kind of thing, did you see any newspaper report? Did you see anywhere somebody wrote a beautiful article on saying that what is it that pinches? What is it that is missing? What is it that is lacking? Because as I said, you try make one of the best public spirited civil servant at the block level, the ability of that particular person to reach to every village, every household is somewhat limited. I would take you back that when we were trying to rationalize the centrally sponsored scheme, good number of all these so-called technocratic people were telling us at that time that, I mean, freeze this ASHA worker and don't try to get this thing. The government, the digital system will reach every household. We realized this is not true because you need a human touch and you need your ground level people. Somebody must visit the house. Now, if that somebody turn out to be the ASHA worker, Anganwadi worker, or foot soldier, and they're not visiting, then you will have the arrangement where the government has put a lot of arrangement, but it is not put to use. And that is why where I see the hope in this, that suppose there is in a system, in a particular place, a system is not working. And as Mr. Suchi said very clearly, and I wish that that happens quite often, that one must, at the government, must hear the ground from the voice from the ground. If you hear the voice from the ground, that look, I mean, this system, you put VHSND. VHSND is a lovely program of Ministry of WCD, Women and Child Development, where in a day, particular day in a village, you provide 7 to 8 important services, and you call. I mean, you go to the places, you tell all the ladies there in the rural area that these things are available. They just come to that particular place and get the thing done. It solves a lot of places. But our survey, I mean, as late as last year, has told us that 30% of the household were not aware of the VHSND that is happening. So that's why, as I said, that first thing is that the lack of awareness. The second one is that bringing the level of the desire to assume or to take advantage of the government service, to speak correctly of the government service and to put it on the perspective, who is going to do that? Because, I mean, one thing is there that we keep on talking about the behavioral pattern of it. That is definitely very important. But behavioralism doesn't simply mean that you tell a mother that her child health is very important. Let me ask, I have not found a single mother in my life who never think that her child's health is not important. What is behavioralism and what is there is to tell the people that, look, these are the facilities which are available. And if you don't happen to go there, then you are going to miss this particular kind of thing. I mean, in vaccination, I mean, one of my friends in Ministry of Health and Family Welfare told me, I was saying, vaccination figure doesn't rise more than 85 to 90%. She said that is इतना पहुंच गया बहुत है, because वहां तक उससे ज़्यादा तुम पहुंच नहीं सकता है. So why is it? I mean, our one of the partner Piramal had tried roping the influencers, the local people who can influence the public opinion, and there we found that if you can use the services of the local people who can influence the opinion of the people, then the result somewhat improves. So what I simply say that twofold role of the civil society and the government working together. The first and foremost is that there must be noise. If the system is not working, which the government has put in place, for which hundreds of crores and thousands of crores have been put as they are all taxpayer money. They are meant for the children of India. If the system is not working because somebody has not done the house, somebody has not done the work of the homework, or somebody at the cutting edge level is not so enthusiastic or not so spirited, then there must be noise. There must be noise that here the system is broken, and that's there. And second is that to assist the state, assist the block level administration, assist the thing to take it to every village, every household, that this is the system which is in place. And that is a role which the civil societies or a collaboration of civil society can do it pretty well. My own experience is that one of our partners has come up with the suggestion that at every block level, we will try to make a collaborative of the civil societies so that some of them can take lead, and there can be a program which can be drawn to say that these were the most important part in a particular administration of the block, in which we would be taking help of the civil services and NGO. Now, one can look at working for the incentive system for that. One can look at and appeal to the better, generally the civil societies are run by pretty decent people, and many of them are pretty well off, and they are willing to do the social service. That's why they're in that sector. They could have earned a lot of money if they are not in that sector. So there one can take advantage of that selfless spirit in this particular sector. And so the upshot of this is that it makes a lot of sense for the civil societies and for us to come together, for the government to come together, and to get the noise and to assist the district administration to reach the every household in that thing. And let me time and again keep on telling you that why I feel that it is very important. Just take the example of the Government of India's very ambitious program of Health and Wellness Center. Now, we felt as the Government of India somehow that we can change the mother and child nutrition and health issue by creating the Health and Wellness Center, apart from solving some of the health's major issues, which is now starting to plague the rural India. And that one is the creation of the 1.5 lakh of Health and Wellness Center over the last 2-3 years. I mean, this is the work in progress, but if you look at the data from the ministry, more than 70 to 80,000 health and wellness centers have been made. But look at the absence of the civil societies, government, this government partnership, or I would say suboptimal. I can't say absence because in many places people are indeed working together. But one of the program of Health and Wellness Center was that you're going to screen the whole society, whole population for 5 diseases, which was diabetes, hypertension, and 3 kinds of cancers. And I've been to some of the health and wellness center. It looks very nice. There is a very great improvement in the in the rooms that is meant for look after the pregnant women, and there is a Lakshya standard, and I think there is that on you're working on that standard. There's indeed a yoga teacher, and that's a very positive thing that they want to kind of get the feeling of remaining as India to be fit. I mean that feeling should be there, because yoga is the least resource intensive program for a particular person from a point of view. It doesn't cost you money to do any yoga or something like that. It costs you time. And but then when we ask the question that have you screened the population, the answer generally is very modest achievement. And why? Because of the general answer that there is no demand. So if you do not, and why is there no demand? Because, I mean, is it that the household don't want to take the advantage of the service? I mean, there are many behavioral issues. If the services are not good, they will definitely not take advantage of it. But if the services is all right, and there need to be, there need to be somebody who's a person who inspires, but the person who takes them to these facilities My friend, who is the Principal Secretary of Health in Uttar Pradesh, was telling me that on a day on vaccination, they have achieved around 30 lakhs in one particular day. Or they have been in last, at least in 15 to 20 days, the performance is still very good. And what they followed was an approach where not only that they put a camp in one place, but before that camp, they put good number of people in those areas who went to every household and told them, look, I mean, one camp, a vaccination camp is coming to your place. So before putting a camp, they put 3 to 4 days of the hard work of convincing people to take advantage of the system that is in place. For a government at the senior level, it has two advantages. One, that your program succeeds. The second is that people who are at the down level, who are people at the level who are doing supposed to do the work, there is a pressure on them that look, I mean, there's so much of आपने अब इतना ढिंडोरा पीट दिया, इतना हल्ला मचा दिया, तो अब अगर वहां नहीं जाएंगे तो फिर तो गजब हो जाएगा. So what Niti Aayog or what we would feel is that there must be this role of the civil society and government platform coming together is to see that the demand for the genuine services must be channelized in a particular manner, which helps us and which helps the state administration to put the pressure on the people who are there to perform at the cutting edge level. Last point I would say, and I think you raised a very good issue that unless and until you see from the perspective of those whom you or whom we are trying to work for or for whom we actually exist, our program is not going to succeed. And that would be that if you try, say, Kodo or something is told you want to eat that, and they will say, ये तो हमारी community में पिछले 50 साल से हो रहा था. In fact, our progress, our climbing of the social ladder is to eat, I would say, I mean, I see it in very different levels. Somebody would like white rice, white atta. I mean, I wish one could get the old red wheat, which was pretty nutritious, but just not available nowadays, thanks to our green revolution. But as you get the white rice and white wheat, I mean, somebody said wheat has completely, I just said, that has dominated the human being. I mean, it has multiplied it so much that human race, I mean, no other species on this planet than the wheat, which has multiplied itself. And it's the most successful one compared to the human being, because the way it's grown is a very small portion in the Western, I believe the Western Asia or something like that. Today, it is the most prolific crop in the world. So the point I was saying was that what is aspirational for a person is something which is not very good from the nutrition point of view. And what has become aspirational from the India's very, very expensive homes, people with very expensive lifestyle, is something which is what these communities ever always had at this thing. So somebody has to do this matchmaking and say that, look, people at the 5-star love to eat the millets. If you do that, I mean, I'm a child. I aspire for choco. I mean, something choco or something. You get it with milk or something, those cereals and choco. And I think, I mean, thankfully, Kellogg never succeeded in India so much. I mean, they came a few years back and they said that we, as a company, are going to change the India's breakfast habit. And somehow they did not succeed. I mean, we thank God for that. So what I'm simply saying is that local food, local this thing, the way it can be spoken in the circles of India's India's who's who, and India's the top class, the highest income class, is something which is valuable to community in many ways, in many things. So if a behavioral campaign is needed to be launched and say that, look, I mean, what you have is basically what people aspire for in 5-star hotel, then I think it will tell the people that give the importance of that. So there again, I mean, there have been a lot of scholarly work on the eat local. There's a lot of work on I mean, they're both sides of work. One is say it's not adequate. There's also work like that in terms of calorie value. The other work is that say that, okay, I mean, you can have a good mix and match, and inclusion of the locally available food is something which is going to help you in nutrition. So I would say that a big campaign from campaign centered on this, that what you consider unfashionable is actually really very fashionable, and what you consider to be the aspirational for you, actually the world is sick of it. are growing sicker and sicker of it by the day. So if that kind of thing is launched, that kind of behavior, I'm happy to announce that Niti Aayog has a behavioral unit that works with us. It is a unit comprised of a unit from Asoka University and also from the Gates Foundation. We're very happy to take up these kind of jobs. Somebody can come together to work on the behavioral aspect. We are not looking at the scholarly aspect of the nutritional content of the local food, but there's nothing wrong in having the local food. In fact, that should be made aspirational. Last point, I would say that in the aspirational district, we, after consultation with a very large number of people, we devised, what we realized was that you ask a district magistrate that what are you doing for health? And answer would be all general terms. But when you say, "Achha, is baar ka diarrhea ka anti-diarrhea kya kar rahe ho?" What are you doing? Because one spate of diarrhea and 3 months of nutritional advantage just go away. So what are you doing for diarrhea? Or what are you doing for, zinc? You are providing zinc or something like that. Now, zinc costs very little to government. Running an anti-diarrhea program costs very little. And government is willing to fund, what to say, that vaccine against rotavirus, which was one of the main thing which create the problem of malnutrition in children. But when you ask and look at a district and say, okay, this is available, have you done it? Or is it possible to do it? There's something. It runs on a typical program where if there is no demand, then nothing is applied. If there is, or it is there in a PSC, or there will be some time of campaign, but not very effective. As I said, that it is possible to make it far more effective. So we created a template. We sent it to all the districts and said, please fill up your yearly nutrition plan with taking into account everything that the government has put in place. And then you try say that what will you do on which day, on which time of the month, what are you going to do, and whether this plan works or not. Now, frankly, we are struggling with this because there is always a set system within the district on which it works. So try give them a template, and then they will try to say, okay, because that's a good question that yes, we are doing that. But if you say, have you done anti-diarrhea, this thing? The answer in a government scheme, if you're on a tick mark approach, then it will not be effective. If you really want to do something, then you have to stand the ground, try to do that. So again, the request from the civil societies are that whatever initiative comes from government, please read it carefully. If there's certain thing which is not understood, talk to us, talk to people in Niti Aayog, talk to people in the ministry, and first be convinced that whether government has left any kind of gap or the system is whole complete, it has taken stock of every problem, and then try to see that how we can work to point out the difficulties, point out the deficiencies in the system, which are all system generated or man-made, which are not part of this scheme. There is a money, there's no dearth of money for this kind of thing. And second is generate the demand and generate the awareness among the very large number of people who are going to do this. And third thing is to make it fashionable, the eating the local thing, and tell them that what you kind of reject from a plate is something what people are adopting at the highest level of income in this country. So with this, I wish you all success. Do send us the concrete suggestion, how do we improve? Because nutrition is one battle on which whosoever contributes, whosoever makes suggestion, whosoever criticize, all welcome. Thank you very much.
Thank you so much, Rakesh ji. It was such a pleasure to hear from you. And as always, you've been extremely critical, not only of the system, but also very constructive in some of the key asks you have, not only from the government, but also from civil society organizations, as well as from the community. And, you've kind of actually highlighted this whole element of civil society raising noise, just to ensure that the government is accountable for their mandate, and also that the civil society organization not only raising voice and monitoring, but also supporting the government in ensuring that we create demand within the community, and also ensure that the outreach elements which civil society organizations, because as Sudarshan said, we have feet on the ground. So we can aid the government to be able to bridge that gap. And then in terms of what do we do with the community, so I think that whole element of recognizing the popular knowledge of the community, but also ensuring that they also recognize that what they know, like you said, many times their aspirations they may doubt their own traditional knowledge. I think it's an important component that we also re-emphasize that vis-a-vis the behavioral change communication related interventions. So definitely recognizing indigenous knowledge and also ensuring that the community also does not undermine their own knowledge, but ensures that we as a collective, the government, civil society, as well as the community together can look at collaborative ways of formulating solutions to a problem which is really it's multidimensional and there is no easy solutions to this. So thank you so much, Rakesh ji, and we will definitely be ensuring that some of the concrete recommendations from this virtual roundtable do reach you, because like you said, there is no dearth of policies, programs, resources. I think it's just that we just need to be able to ensure that each of us play our role in this to be able to handle this very critical problem of undernutrition. So with that, once again, a big thank you to you from all of us as part of the whole collective here. And I will now move on to inviting Sonal to take the conversation forward, Rakeshji. And if you see, we have Sarojji, who's representing the front line of our fight against nutrition. She's an Anganwadi worker. So it will be great to hear her insights, because their role becomes extremely critical to bridge the gap between the government, civil society, as well as the community. So over to you, Sonal, to take forward the conversation, and inviting Sarojji also to share her insights. Thank you so much.
Thank you so much, Namrata. So, just to bring the voices from our frontline functionaries, we have with us Mrs. Saroj, Srimati Saroj, who is working as a Anganwadi worker in one of the Anganwadi center of Delhi. She is working in this area for last 14 years, and even during COVID, she actively engaged with families to educate and sensitize them on COVID appropriate behaviors, how to take nutrition, how to take care of their, how the families can take care of their children. And also she was very extremely instrumental in linking the families with the government programs. So now I would like to invite Sarojji. सरोज जी, क्या आप मुझे सुन सकती हैं?
यस मैम।
नमस्कार सरोज जी, और आपका बहुत बहुत धन्यवाद कि आपने आज हमारे इस कार्यक्रम के लिए इतना समय निकाला। आपसे मैं कुछ चीजें जानना चाहूंगी। आप आंगनवाड़ी कार्यकर्ता के रूप में एक लंबे समय से काम कर रही हैं, तो क्या आप यहाँ आज हम सभी को बता पाएंगी कि आंगनवाड़ी के रूप में जब आप अपने क्षेत्र में अपने एरिया के बच्चों को और माताओं को सेवाएं देती हैं, तो खास करके बच्चों को पोषण संबंधित सेवाएं देने के दौरान आपको किस किस तरह की समस्याओं का सामना करना पड़ता है, या आप किन किन परेशानियां आपको देखने में आती है?
नमस्कार सभी को, मेरा नमस्कार। मैं सरोज शर्मा, आंगनवाड़ी कार्यकर्ता हूँ। सबसे पहले हमें दिक्कत आती है उन महिलाओं की जो वर्किंग है, जो फाइनेंशियल कंडीशन नहीं है, जिनकी अच्छी पढ़ी लिखी भी नहीं है। इस हाल में उन दोनों को वर्क करना पड़ता है, माता को भी और पिता को भी। इस वजह से वो अपने छोटे बच्चे को घर पे छोड़ के जाती हैं किसी दूसरे बच्चे के भरोसे, जो उसका बड़ा बेटा होगा या बेटी होगी 10-12 साल की। वो सुबह 9 बजे या 10 बजे निकलेगी और आएगी 1-2 बजे। 3-4 घंटे का गैप हो जाता है। वो दूध पिला नहीं सकती, कुछ खिला नहीं सकती। उसे पता नहीं पीछे से मेरे बच्चे को कैसे रखा जा रहा है या क्या खिलाया जा रहा है, कुछ नहीं पता उसे। वो जब भी आएगी 1-2 बजे, वो उसके बाद अपने घर को देखेगी, उसके बाद बच्चे को देखती है, ना कि वो आते के साथ ही बच्चे को देखने लग जाती है। अब वो ये नहीं पता उसको बच्चे को पीछे से उसको दूध पिलाया गया है या नहीं पिलाया गया। जब 3-4 घंटे का रोज गैप होएगा तो अपने आप कुपोषण आ जाता है बच्चे के अंदर। दूसरा, यहाँ के लोग जो है, बहुत सारे लोग ऐसे हैं जो माइग्रेट करते हैं, एक जगह से दूसरी जगह जाते रहते हैं, उनका कोई फिक्स काम नहीं होता। उनके पास कोई ऐसा फिक्स वर्क नहीं है कि हमें यही काम रोज मिल जाएगा। उन्हें काम ढूंढने के लिए एक जगह से दूसरी जगह जाना ही होता है। तो इस वजह से भी उनकी आंगनवाड़ी की सेवाएं बंद हो जाती हैं और हमें बंद करनी भी पड़ती है, क्योंकि हम ऐसे नहीं छोड़ सकते उसको। कोई हमारे पास ये लिंक नहीं होता कि हम इस एरिया से गया तो उस एरिया में हम इसको बता दें कि ये हमारे एरिया में अब नहीं है। तो इस वजह से भी हमें दिक्कत आती है बहुत ज़्यादा, क्योंकि उस टाइम हाइट वेट होता है तो वो बच्चा हमें मिलता नहीं है, और दूसरी जगह वो चला गया तो उसको वो प्रॉपर सर्विस भी नहीं मिल पा रही है जो हमारे से छूट गई है उसको। इसके बाद हमें आती है हमारे पास दिक्कतें, जो हमारे पास कुक फूड आता था पहले, वो तो कुछ लोग तो खाते थे, कुछ माताएं खाती थी, कुछ बच्चे खाते थे नहीं खाते थे, क्योंकि रोज रोज खिचड़ी दलिया आता है तो कोई भी खाना पसंद नहीं करता है। अब THR आता है, पहले से बहुत बेहतर है, पर अभी भी कुछ समस्या है इसमें भी कुछ हमें, क्योंकि ये नहीं पता कि परिवार में कौन खा रहा है, क्योंकि हमारे पास से तो वो चला जाता है पैकेट, हम तो रिसीविंग ले लेते हैं, पर ये नहीं पता उसको कौन खा रहा है, पूरा परिवार खा रहा है या बच्चे को मिल रहा है। इस वजह से भी वो कुपोषण आ जाता है, कई बार हाइट वेट में भी कमी आ जाती है। कई बार तो ऐसा होता है उस जो हमें दलिया मिलता है जैसे, उसको वो राशन की गेहूं के साथ पिसवा लिया जाता है, तो पूरा परिवार मिलके खा रहा होता है उसको। तो ये भी दिक्कत है हमारे साथ। तो हमें पता नहीं उसको पर्याप्त मात्रा में मिल पा रहा है या नहीं मिल पा रहा है। ऐसी बहुत सारी समस्या है माताओं को भी और हमें भी, जो हम पूरी नहीं कर पाते हैं।
जी, सरोज जी, आपकी आवाज थोड़ी कम आ रही है, तो क्या आप अपना माइक थोड़ा नजदीक करके बोलेंगी ताकि सब लोग और प्रॉपरली सुन पाए?
हाँ जी, हाँ जी,
हाँ जी। और कुछ आप इसमें जोड़ना चाहेंगी?
मैम यही है कि कुपोषण तो इसी वजह से ज्यादा होता है, जब बच्चों को ध्यान नहीं दिया जाता, वो शिक्षित नहीं हो पाती है माताएं। उनको यही, जब उनके पास टाइम नहीं होता है खाना बनाने का कि मैं अपने बच्चे को क्या बना के दूं, उसको कैसे दूध पिलाऊं, तो इसी वजह से ज्यादा हो पाता है।
जी जी जी। तो एक और चीज हम आपसे जानना चाहेंगे कि आप और आपके जैसे दूसरी आंगनवाड़ी कार्यकर्ताएं जो अपने अपने क्षेत्र में बच्चों को पोषण संबंधित सेवाएं देती हैं, वो अपने क्षेत्र के बच्चों को और बेहतर सेवाएं दे सके, इसके लिए आप एक या दो क्या सुझाव देना चाहेंगी यहाँ आज उपस्थित सभी लोगों को?
मेरे हिसाब से आंगनवाड़ी रूम्स जो है अपग्रेडेड होने चाहिए थोड़े, और वैसे हमारी पहले से बहुत अच्छी सेवा फैसिलिटी हो गई है, हमें फोन भी मिला है, वेट मशीन भी मिला है, पर हम थोड़ा चाहते हैं थोड़ा और एडवांस मिले। पर कुछ लोग माताएं होती हैं जो बोलने से इतनी जल्दी नहीं समझ पाती हैं, उन्हें वीडियो या फ्लो चार्ट के जरिए समझाना ज़्यादा इजी होता है। तो मैं चाहती हूँ कि इस वजह ऐसी कुछ फैसिलिटियाँ हमें अच्छे से और मिले, और अपनी आंगनवाड़ी बहनों को मैं यही समझाऊंगी, इन बच्चों को अपना बच्चा समझे और इन बहनों को और अपनी बहन समझे, तो ज़्यादा अच्छा रहेगा। धन्यवाद।
थैंक यू सो मच सरोज जी। और आपने बहुत अच्छे तरीके से जो भी समस्याएं आ रही हैं आज यहाँ पे रखने की कोशिश की है। बहुत बहुत धन्यवाद आपका।
थैंक यू मैम।
ओवर टू यू नम्रता।
थैंक यू सो मच सरोज जी। आपने बिल्कुल जो ज़मीरी स्तर पे जो आपके चैलेंजेस हैं उसको बताया, और उसके साथ साथ बहुत अच्छे कुछ सुझाव भी दिए। तो उन्हीं सुझाव को आगे ले जाते हुए, नाउ व्हाट वी हैव इज अ राउंड टेबल, and the main objective of this round table is to deliberate on challenges and adaptive strategies and approaches to ensure effective implementation of community management of child undernutrition. And we realize and recognize, and as that's the mandate of this particular conversation, that we want to understand, despite all the well-intentional policies, programs which are there in India, we are still struggling. The whole, issue of undernutrition and malnutrition is still, it's such a critical problem. So where is it, and what are the bottlenecks? And can this whole element of ensuring a greater engagement of the community in managing child undernutrition, could that be one important area which needs to be strengthened? So to just have a greater insight on really looking at that element, we have a very esteemed panelist. So our panelists are, we've got Rashmi Singh, who is who's the Special Secretary cum Director, Department of Women and Child Development and Department of Social Welfare, Delhi. We've got Dr. Abner Daniel, who's currently working as Nutritional Specialist at UNICEF India Country Office. And we've got Dr. Antaryami Das, he's the Head Nutrition, Save the Children. So we've tried to, in this panel, we've tried to include the government representation, representatives from UNICEF, as well as from Save the Children, which, really highlighting the representation of civil society organizations. So I would like to briefly introduce the panelists, and then I'm mindful of the time. So we would try seeing how we want to moderate this particular panel discussion so that we can ensure most effective use of the remaining half an hour which we have with us. So Dr. Rashmi Singh is an IAS officer who has served in the state government of Delhi, Union Territory of Andaman and Nicobar Island, and MWCD. And she has on her credit, she's worked on innovative models for sanitation, climate, and value education of children. And she's also pioneered the initiatives like Convergence Forums for Children, Shakti Sammanva camps for women to bring government schemes closer to them, and Arundyay Wellness Center for Women at Port Blair. Welcome, Dr. Rashmi Singh. The other panelist, Dr. Abner Daniel, he has also worked across different states in India, and he has worked in the area of policy formulation, program design and implementation, advocacy, knowledge management, and also delivery of results and partnerships to build improved outcomes on maternal and child health and nutrition. And he's currently involved in supporting the rollout of comprehensive programs for prevention and treatment of acute malnutrition. So welcome, Dr. Abner Daniel. And finally, Dr. Antaryami Das. So Dr. Antaryami Das is a public health and nutrition expert with over 14 years of experience in the field of nutrition. And he heads the health and nutrition portfolio at Save the Children India. And he's also worked with UNICEF in the past, delivering results at scale on both nutrition-specific sensitive sectors through a systems approach. So may I request Dr. Rashmi Singh, Dr. Abner Daniel, and AD, you already have your video on so that people can see our esteemed panel. And we will start with Dr. Rashmi Singh.
Yeah, okay, thank you.
Yeah, so Dr. Rashmi Singh, thank you so much. Thank you so much for joining us. And as we mentioned, we are really looking at this whole element of how do you implement community management of undernutrition and what are the government strategies and expectations from CSOs. So as you would be aware, ma'am, that, since COVID-19, food security in families is a huge concern. And the government is also, really working hard to ensure that we address this whole element. So we just wanted from your side, if you could just throw some lights, ma'am, on how your department is managing to keep focus on, prioritizing identification of undernutrition and undernourished, especially SAM and MAM children, and their management at community level. Because, many times because of ensuring that we address the COVID-related, pressures on the government, many times this particular element may get under prioritized. So we just want to kind of understand from your side, ma'am, what have been the steps you've taken to ensure that the identification as well as the management at community level of SAM and MAM children is effectively undertaken. Over to you, ma'am.
So, first of all, I would like to congratulate all the other panelists and Save the Children for having undertaken this very important topic of community management, because I think the topic itself really underscores the need for, a better kind of management systems in this whole nutrition dynamics. And I must say, I was happy to hear one of our Anganwadi workers, Saroj, whom I would like to compliment, that she herself has come up with things like, breastfeeding and how that is important. And if women don't have access and maybe, to link with the need for more creches, so those are some certain things which she's also kind of thinking about. And I think it is important that when we are looking at nutrition, we look at the whole rubric of other multi-dimensional factors and, intersectoral factors, which are actually responsible, to ensure that, whether the pregnant and lactating mothers or the adolescent girls or the children who are our target group under the ICDS, they are served holistically. Having said that, now to answer the question of Dr. Namrita, that, during the COVID, how do you did you make sure that the identification is done? And number two, how do you make sure that, more targeted intervention is done for the SAM and MAM? So I would like to respond to that. Now, in terms of, identification and bringing more people into the fold, I think during COVID, Delhi, if you look at the statistics, there's been a remarkable jump in the number of, beneficiaries who are now into our supplementary nutrition program of the ICDS. Now, how that has happened is because somewhere we have also used the digital technology, to add on to the number of, parents and who were otherwise not really connected, because earlier not everybody would come to the Anganwadis. So during the COVID period, in association with other organizations like Pratham and of course Save the Children is, also a partner organization. So we tried to bring about a huge digital connect, from the headquarters to the CDPOs, to the supervisor, to the workers, having trained them in a cascading model and beyond the workers. Then it was the parents' education. So the parents' education really happened in large numbers in terms of what are the services which are provided by the government through, say, the ICDS program, through the POSHAN program, through the maternity benefit program. So we actually talked about all these programs, and within ICDS, we demystified all the components, be it the immunization, the health referral services, be it the early childhood education, the preschool education part and the nutrition part. So, that was done in a way in which, so the parents who were earlier disconnected, I think we succeeded in bringing them, much more into looking at their own role, as parents, and which is the first step towards community management. First step, because unless they realize their role as a parent, they would never, really be able to take ownership. So, bringing them to first get connected. So as I said that there are many large numbers, I think we had a jump of around 42% over the last few months, amongst the children who got connected to, say our SNP program. And thanks to that, the parents who got connected. Yeah, because as I think our Anganwadi worker was just telling, we went there with take-home ration, doorstep delivery. So it was actually done door to door. But it wasn't just that the nutrition being provided there makes a difference. The connect with the various services, the fact that, our workers are able to talk to them, convince them that how to keep your child healthy. So that is like a first step of building that connect. And, thanks to the POSHAN tracker app, which has now come in. So there we are encouraging, all families, all beneficiaries to become a part of this awareness about what this app is all about. So, entering the data of the beneficiary, but more important, not just the data of, how many are enrolled, but also the height, weight, what the growth monitoring indicators are telling us about SAM children, MAM children. So now we have started developing this data in full participation with the parents, because we do realize that unless parents themselves take part in it, just having the data in a POSHAN tracker will not be good enough. So it's demystifying data, making them a part of it. That is another thing which is happening, because now with the kind of alerts which are being generated in our system, we know exactly how many children are in what category, whether SAM, MAM, anemic, the underweight children. So, making parents a part of it. In fact, I myself, interfaced with, two of such families. And it was very revealing to me that it's, there were certain medical reasons, health reasons with the child, which the parents had been ignoring. In one case, there was TB. In one case, there was protein deficiency, and the child would not be able to absorb proteins at all. So here there was like, first step was, trying to tell the, parents that, well, you need to become more serious about it. Yeah, we are there to help you, because health referral is one of the services under the ICDS. But again, health referrals, unless the parents understand the critical significance of what it means, if the child has to be brought above the standard of stunting, wasting, which the indicators are clearly telling us. So that kind of engagement that we have encouraged even our other officers, say our child development project officers, that engage with that dialogue with the parents, so that they understand these critical indicators. Not enough that in our books, we have the data of wasting, stunting, SAM, MAM. It's more important that ownership is built, and their role, what they can bring about, in terms of the behavioral change again. Now, the last thing which I would like to mention is that we, in this entire discourse, between say, the ICDS cadre, the community, today we have tried to make this a part of a regular dialogue series through, something called Saheli Samvad program. Now, what is it? We have like a set of Anganwadis, which are like called the SSKs, so, Samanvay Kendra. In the Samanvay Kendra, today we have like the POSHAN team, the maternity benefit team, the ICDS cadre talking to each other. So that is Samanvay, literally is the convergence, so talking to each other. But in that talking to each other, we have also tried to introduce the idea of self-help group, SHGs of women, who are a regular part of this conversation. So maybe you can say that these may be initial stages in terms of, putting the structures and systems and workflow, fully, in place. But it is a, beginning where we saw that many of the actors were not really talking to each other. Now, another thing which I would like to mention is at the district level, at the level of the district magistrate, now we have created these nutrition committees. And at the state level, we have constituted a committee of state advisory committee, where under chief secretary, we have the urban local bodies, we have all the line departments, be it education or health, or, family welfare, and, also academic institutions. We also have, say, DCPCR, the Delhi Commission for Protection of Child Rights. So bringing all these various actors together, in terms of looking at their role, and we had a meeting recently of this committee where now it is being emphasized that disaggregated data to be captured on a real-time basis, so that there's ownership for this data, with the various departments, and the departments like WCD and Health and Family Welfare, they have a system of regular data exchange with each other, so that we know that which child we are targeting and how through collective effort of ASHA and Anganwadis and ANMs. Now, this is something, in my view, is the real bedrock of convergence if the data systems talk to each other, which is what we are trying to do, through both like physical interface, because people also have to start talking to each other. So regular meetings, at the district level, at the level of the MOs, the medical officer, this is one thing that we are insisting on, because regular meetings of MOs with our CDPOs, brings the kind of coordinated effort, a joint planning, towards what they're going to do for the next month. Now, this was something which was like, taking like a backseat, because face-to-face meetings are not happening. But digitally, we are now trying to, bring a connect with all these various actors, starting, as I said, at the highest level. But at the same time, we hope to, make it a part of the culture of this regular dialogue, sharing of information with each other, along with, the community management, where the data is mystified and brought to the community for them to take full ownership. Thank you.
Thank you so much, Rashmi ma'am. And I'm taking notes, and it's such a pleasure to hear some of the initiatives which have been taken by your department, and this whole emphasis on how digital technology, but also demystifying data for the community, I think becomes extremely critical. You've talked about parents' education, but more as collaborators, so that they also have a strong partnership in this whole element. And the POSHAN tracker app, and where definitely there's going to be convergence, which you said, and which the government has been really looking at ensuring the convergence, but how also that in that particular process of convergence, how community also becomes an important partner. So this whole element of also demystification and ensuring that the dialogue, the discourse of dialogue from the state level to district to the community, is undertaken in an effective manner. And finally, your whole element of the Saheli Samanya Kendra, I think that's this whole element.
It's like an integrated center for
Yeah,
community
very
children,
interesting.
where we are not breaking issues like, it's actual intersectoral convergence happening on a real-time basis.
Very good.
Yeah, where nutrition is not seen as a standalone thing.
Absolutely.
So actually it's nutrition, childcare, livelihood, health, education, all seen together.
Thank you so much, ma'am. So I think some very important insights for us on also how do you strengthen this whole element of, community management, and how parents can come as, equal partners and collaborators in this whole fight against undernutrition. We will come back to you, ma'am, but I'll just go forward with, some quick questions to Dr. Abner. So, you would definitely highlight and agree, Abner, that community management of acute malnutrition in post-pandemic period is very critical. So what would be your observation or insights on how effectively do you think community management of acute malnutrition is happening in the post-pandemic period? And more so, how important is it for the government system, civil society, as well as development partners to work in a collaborative manner? And Rashmi ma'am has already highlighted, some of the initiatives which the Delhi government is doing, but your insights from the vantage point of where you are working, Dr. Abner Daniel, it will be great to hear from you.
Thanks so much, Namrata, and thanks to Save the Children for inviting me to this virtual roundtable. So reflecting also on the previous speakers, I think I wouldn't agree more. So when we look at acute malnutrition, there is no disagreement to the fact that prevention comes first, right? And for prevention, we heard of so many important initiatives, and I also reflect on what Sarojji said, like in the families, that there is no person at home to care for the child, the parents are working. So here again, what is it that can be done? And I remember within IYCF, we have this component of expressed breast milk and those kind of solutions that are there, which of course need to be tested for feasibility in a particular context. So clearly for prevention of malnutrition, there are various ways to approach it, and we know there are nutrition sensitive and nutrition specific interventions we can talk about. We will not have time to cover all of them, but notably we know the interventions around infant young child feeding, interventions around maternal and adolescent nutrition to prevent low birth weight, and interventions around health and wash systems. For example, if the child has diarrhea, so how the improvement in water supply can have an important, and sanitation services can have an important impact on it, in addition to providing ORS zinc. So all these are important components of the prevention of malnutrition agenda, which come first. However, we also know that prevention many times fails for many children, many vulnerable families. And in this situation, the child does land up with malnutrition or acute malnutrition being measured by wasting levels. So these are the children clearly who need that additional extra support, and they need to be provided with the best possible package of services so that they can come out of this dangerous situation. So clearly, again, there's no disagreement again to the fact that people acknowledge, and especially Government of India and the Ministry of Women and Child has acknowledged that children with SAM is also a priority. while our attention, of course, during Poshan Maah is on Jan Andolan, people's participation. And of course, there are so many initiatives that are currently being rolled out by government. And we heard the earlier speakers talk about many of them. But for the children who are indeed identified as being vulnerable, as being at nutrition risk, so these children need to be identified as early as possible and be provided with a package of services. Unfortunately, today there is no national guideline on what such a package should look like. However, we have seen many state governments who have taken the lead in terms of designing the best possible package that can be delivered in a particular context. And I could go on with so many examples of many states where UNICEF is currently working in, be it Madhya Pradesh, Assam, Maharashtra, Gujarat, Rajasthan, Telangana, Uttar Pradesh, where large-scale responses are being designed and are being rolled out, so that these children can benefit from more intensified package so that they come out of their severe malnutrition status and then are linked to the existing preventive services. Now, of course, we heard so much from the previous speakers about the challenges. And of course, there is no magic bullet to those challenges. You have to have your health system strengthening building blocks being well addressed, if you want to see quick results. And of course, the opportunities and platforms offered by the Niti Aayog, by the aspirational district work clearly paves the way for testing ground for us as development partners, or for that matter as civil society organizations, to reach out to first, demonstrate what is possible, and then take those learnings to the wider geographies. So I think I would, in the interest of time, also try and stop there. But also I know that COVID has further complicated matters. It has made the situation worse in terms of nutritional outcomes of children. And not only that, the capacity of the system to respond, because clearly there are parents who are less inclined to access health and nutrition services, but also the delivery of services are now being adjusted. And we see a lot of digital mediums being used for communication, for example, WhatsApp groups, or for that matter, growth monitoring in batches, rather than the usual calling all children to the center for those camps. So these do make implementation of our existing priority programs challenging. But again, here I would like to bring attention to the examples from many of the states where they have, made those adjustments. Like, for example, I remember in Maharashtra and in Madhya Pradesh, there are clear guidelines to frontline workers to use WhatsApp groups to communicate the right messages to the families. And I'm sure these are not, ready-made solutions, but again, something that depending upon context, depending upon how the COVID appropriate behavior and recommendations evolve, that these services need to be adjusted and they need to be flexible. But I think many learnings within India, within the states, that we all could learn from and help state governments and district administrations to take those initiatives forward. Thank you.
Yeah, thank you so much. And I think you've very clearly highlighted not only in terms of the preventive elements, but also how do you address this whole element of acute malnutrition, Sam and ma'am. And yes, definitely, we are talking about Poshan Maah and this whole element of Jan Andolan and people's participation. So, so thank you so much, Abner, and also the fact that some of the examples which you have shared on what national level and also at the state level, how contextualized solutions are being undertaken by state government to be able to address this whole element of nutrition within the COVID context. So we will come back to you in terms of what would be, one or two critical recommendations you could give more from, really highlighting more the preventive aspect and also where the community can play a greater role in terms of managing, undernutrition, so that we don't require, we don't reach the stage where institutional care is required. You can address the problem right at the onset. So I'll come back to you on that, but I would just like to move on to Antaryami Das. And very quickly, Antaryami, we at Save the Children have been doing some interesting insights in the field on really looking at how effectively, community management of undernutrition could be undertaken. Some key models and practices, which I know you have, been very closely associated with. So it'll be very helpful if very quickly you could share maybe one or two of some key practices, so that we can also, the other people who are there in this discourse can also learn from, and the government can also scale it up to other regions, contextualizing it to the state and the district level context. So over to you, AD. Some quick, if you could take quick one or two example, that will be very helpful.
Sure, Namita. Thank you. So there are many models that we have tried in Save the Children. So basically, we tried with 4 different types of community management of acute malnutrition program in Kolkata, in Bombay, in Andhra Pradesh, and in Jharkhand. We have tried with different product modification. There are programs we tried with RUTF, using a ready-to-use therapeutic food. There are programs we tried only with positive deviance and counseling. Now, the most successful program that I would say is now we are implementing in Jharkhand in 2 of the aspirational districts, in Gumla and Singhbhum. There we are doing this, in a home visit and intense counseling at the household level to augment their household diet. This is the program we are doing after having a detailed assessment of the cost of diet. There we realized that the nutritious food is 2.5 times more expensive than the calorie only diet. So for the majority of people, it is unaffordable. So thereby, along with our counseling package, we are promoting the POSHAN Batika. That is also part of this nutrition month. So, and we realized that those households having access to a kitchen garden are ensuring dietary diversity for their children. And this program is proving to be very successful, although we have very limited sample size. As of now, only 750 have been tracked for 4 months, and we realized that there is a 41% grade improvement in those children. Either they have improved from SAM to normal, or SAM to MAM, or MAM to normal. At least for the 41% of children, this is happening. And this proportion of grade improvement is happening more for the girl child than the boys. That's the good part. From 4 other states, we realized that if you promote kitchen garden in institutions like schools and Anganwadi centers, it has a trickling down effect in terms of community and households having access to a kitchen garden. They are more motivated to have a kitchen garden if they see that the schools and Anganwadi centers also have a kitchen garden, and indirectly in those households you see the dietary diversity is improved. So these are few of the quick learnings that I will say for now that we see is proving, and these programs are scalable. In every state we can do this thing because these are aligned with the POSHAN Mission 2 or the existing Jan Andolan component. Yeah.
Thank you. Thanks so much, Antaryami. I wish we had time to go into more details, but thank you so much for highlighting some of these experiences, especially in this whole element of dietary diversity and really looking at the cost of diet initiatives which we have undertaken. And this whole element of POSHAN Vatika, I think those are simple solutions which definitely can be scaled up. So before I open the floor for question answers, I thought one round more from the panelists, just in terms of not only highlighting the problems and issues and the best practices, but really looking at some critical recommendations. So I will take 1 minute each from each of the 3 panelists. I'll start with Dr. Rashmi Singh. Dr. Rashmi, would you want to share one critical recommendation from your side, which you think will be very, very essential to ensure that community management of child undernutrition can be more effectively implemented, not only by the government, but even if we have to have other actors engaged in it? What would be your recommendation? One top recommendation from your side would be very valuable. Dr. Singh? So maybe we could go to Dr. Abner and then come back to Dr. Singh.
Yeah, thanks. So very quickly,
one critical recommendation would be very helpful. Yeah, because I think we have to move forward, and what from your experience and from the discourse which we've had, yeah, just prioritize.
Maybe I will. Yeah, I will use 1 minute, but to mention 4 critical recommendations.
Perfect. Yeah.
So one of them is that we have programs, but they are not yet at scale. And I think there is no reason why these programs should not be at scale, that is across the country. So that is number 1. We have POSHAN Maah, and we also now have Mission POSHAN 2.0 that the government has announced. So we hope that this will be an opportunity to take these programs to scale. Second is POSHAN Maah is indeed a great initiative, but we need 12 POSHAN Maahs. So we need continuity of the focus and the services that are being offered during POSHAN Maah, so that people really get the benefit of the services throughout the year. Third is we need to track outcomes. So clearly having identified children as SAM and linking them to some services is alone not enough, but we need to track whether these children have benefited, and more importantly, if these children have indeed improved, do they stay improved or do they sustain the recovery that they have obtained? And finally, focus on the youngest children. So we know these are the most vulnerable, and we have done some studies with some of our partners. We realized that children are, they falter early and then they remain in that compromised state for a long period of time. So if you're able to address children young enough and early enough, hopefully that will have lasting impact in terms of the outcomes that we are seeing in children. Thank you.
Thank you. No, I think you made the best use of the 1 minute we gave you. So thank you so much. Some very, very valuable recommendations. Antaryami Das, would you want to come in? Yeah, you can use the same parameter, 1 minute, and
yes,
give your
minute,
recommendation.
Yeah. 1 minute, and I will not repeat those points as Dr. Daniel said. They're extremely valuable and very important. I thought of sharing those things, but I will not. Now I will add and build on from what he said. Number 1, that absence of any gold standard therapeutic food should not prevent us from trying out with available food options that we have. So we should keep continuing and keep trying with existing food options that we have. Number 1. Number 2, now we should ensure continuity of essential health and nutrition interventions, maintaining the COVID appropriate behavior. COVID pandemic, this restriction should not be an excuse to stop any of these services. Third, I agree with Dr. Daniel that tracking and monitoring of those children are extremely important, especially focusing on the defaulter. Now we see that 20 to 30% of children from the CMAM programs are always defaulted from this program. Either they don't come or they come for a few days and then don't come. So we need to analyze and target them specifically so that the program coverage will improve.
Great, thanks. Thank you so much, Dr. Antaryami Das. And Dr. Rashmi Singh, are you there? We'd love to hear you, ma'am. If not, then there are some questions which we have, which the participants have raised. So, Sonal, would you want to read out? That will be helpful so that we can at least have, interaction from the people who are part of this conversation. Could you just read them out? Yeah.
Sure, Namrata. So basically, we have 2 questions here. One is about any nutritional package government has announced for orphan children.
So would any of the panelists want to respond to that?
Not sure about the exclusive nutritional package, but during COVID time, any children getting orphaned, there is a special package of shelter home, then giving the financial benefit and taking care of the child from a holistic perspective. But I'm not sure if there is any specific declaration on only the nutritional needs. Maybe Dr. Abner can highlight.
No, I think, yeah. So basically, this is a child protection issue where we know within the ICPS program, there are many provisions in terms of district committees that would look after or take care of the overall needs of the children. But otherwise, I have not heard of any specific separate kind of a nutrition package for such children.
Thank you, Dr. Abner, and maybe that could be one of our recommendation that we do look at some specific nutrition-specific package also for orphans. And Sonal, would you want to come in with the other question?
Yeah, so we have another question in the question and answer section. So if any of the panelists can want to reply in the same section.
Yeah, so you're talking about Arundhati's question, right?
Yes, yes, yes.
Right. So I think, yes, Arundhati has raised important issues about the challenges, especially in COVID times, when community-based services were disrupted and there were no growth monitoring or no VHS&Ds happening. And at the same time, referral to facilities was also a challenge. And this is actually exactly the reason why I think the POSHAN Maah focus on rolling out programs for addressing children with SAM becomes so important. And that is also the reason why this virtual roundtable, which has been organized at an opportune time, becomes all the more relevant. So clearly, this is exactly why the need to intensify our programs, especially programs that are around community management of children with acute malnutrition, becomes extremely important. That you need to identify such children early and provide them with the best possible care and support. And this is, I think, more urgent now than ever because of the reasons that you have mentioned in the question. So I fully think that this is the right time. But all government partners, development partners, organizations need to come together and speak in common voice so that we're able to bring the maximum benefit to the needy children. But yeah, these are, in your question, you have mentioned all the challenges that I think are important for us to acknowledge and then move forward from there.
Yes, thank you. Thank you so much for the panelists for responding to these two critical questions. And there have been certain, conversations happening on the chat also, but I'm mindful of the time. So I would just like to kind of wrap up this particular very rich discourse. And as Dr. Abner, you've already highlighted that definitely this problem of malnutrition and addressing it requires complementary, multi-sectoral strategies and approaches, as well as partnership among different partners. And I think today's discourse has really highlighted that very, very adequately. And additionally, where we are talking about partnerships, not only of the government, civil society organizations, UN agencies, corporates, but also community and parents as equal partners. And I think that is where we would want to really emphasize that community management will become an important pivotal role to be able to address undernutrition, along with other components which have already been highlighted. So as very rightly Rakesh had said in the beginning, that we do have a lot of policies, programs, finances, but ensuring its effective implementation would require these kind of different actors and approaches and people coming together. So while some of the recommendations have been highlighted by the panelists, I would like to also include some of the critical advocacy asks which we at Save the Children have been ensuring that we kind of reach out to the government, whether it's the Ministry of Women and Child Development or Niti Aayog. So one critical element which we have really emphasized is that within the ambit of POSHAN 2.0, while there is an emphasis on really ensuring community management of acutely and SAM and MAM children, but we want to really highlight that we can have national operational guidelines to ensure that CMAM interventions take place, and also that state governments can prioritize the effective implementation of these guidelines. So operational guidelines will become very, very critical. The other piece is which we have really highlighted in today's conversation, where we are talking about this whole element of having a nutritious diet, which is affordable and which is nutritious for the children. So really ensuring that there is home augmented local foods which are key to CMAM, and they need to be prioritized. And how we can, as AD mentioned, this whole element of the nutrition kitchen gardens or vatikas at home, as well as in the Anganwadi centers and schools, will become very, very critical. We did talk about, and where we were listening to Saroj, she did talk about this whole element of the role of frontline workers and the whole role of home visits, as well as ensuring dietary counseling. That will become very critical for CMAM, and it is showing results, and I think that needs to be scaled up, spread across. This whole element of ensuring that within COVID context, we do prioritize identification of SAM children from community, and we do ensure that the facilities are still available, whether it is really looking at Anganwadi centers being off, ensuring permanent Anganwadi centers or simple elements like that, or capacity building of our service providers. So it is very important that addressing the nutrition needs of our children does not get deprioritized when we are looking at addressing the elements related to COVID. So definitely following the COVID appropriate behavior, but really ensuring that we continue prioritizing this whole element of addressing children's nutrition. We have from the beginning really talked about, and Rakesh Ji's session really highlighted also the role of not only the government, where we are talking about effective implementation. We did talk about this whole element of using technology, use of data. So I think those are important critical elements, but also the role of civil society organizations. And to hold the government accountable, to ensure we bridge the gap between the service providers and the community, to ensure behavior change, to ensure there is a demand driven element approach to addressing child nutrition. I think there's a whole lot of components where civil society organizations can play a great role. But in all that, I think it's very critical that we still recognize and put the communities engagement right in the center. So the involvement of parents, of mothers, I think that will become very critical, recognizing their knowledge, recognizing their solutions. Unless that is not done, I think we will still continue having only solutions which may not work in the local context. So I think that is something which is a great takeaway from this roundtable. So finally, I think each of us as different stakeholders need to re-emphasize and re-engage. And as Dr. Abner, you very rightly said, let's have 12 POSHAN Maahs. Why should we have only September as the POSHAN Maah? Let us mainstream it, and let us ensure that only then can we really address this whole element of children's undernutrition. So with that, a big thank you. We would be coming out with a brief report of this conversation, which will be shared with the ministry, with Niti Aayog. We would also be sharing it at the state level, so that the conversation does not get restricted only to this panel, but we do ensure that it is one step forward in terms of advocating and also strengthening the collective collaborative solution making process, which we all are really wanting to engage, and which we hope this virtual roundtable has been able to contribute to. So with that, on behalf of Save the Children, I just want to thank all the panelists. I want to thank all the speakers, all the participants, and like we said, technology does have its advantages, but big disadvantage. We are unable to see any of those participants. We are unable to open up the floor for a more richer discussion. But thank you so much. And we look forward to partnering with all of you as we continue in our journey to ensure that we meet the nutritional security of the children of India. So thank you, Sonal. Do you want to kind of come in to say your final last words? Yeah.
Thank you so much, Namrata. Thanks a lot for the beautiful moderation. And I would also like to thank all our panelists and speakers to spare time for this discussion. And thanks to all the participants to be here and listen to the discourse. Thank you so much. Thanks a lot.
Thank you.
everyone.
Thank you so much. Bye-bye.
Thank you.
Thanks.
Have a
Thank
nice
you.
day. Bye.
Thank you.